Today, we're going to dive into the fascinating world of pharmacology, the science of how medicines work. If you've ever wondered why a pill makes you feel better, how your body reacts to it, or why some medicines work perfectly for certain people but seem useless or even harmful for others, then this guide is for you. By the end of this video, you won't just hear big medical words, you'll actually understand them. You'll understand how medicines interact with your body, why dosing matters, why timing matters, and why pharmacology is one of the most powerful tools in modern healthcare. So, get comfortable, stay curious, and let's get started. To truly understand how medicines work, we first need to answer a simple but important question: what exactly is pharmacology? Pharmacology is the study of drugs, also called medicines, and how they interact with living organisms. But beyond the textbook definition, pharmacology is really about communication. It's a conversation between a medicine and your body. The medicine sends a chemical message, and your body responds in a biological way. And just like in human communication, clarity is everything. If the message is too weak, it may not be heard. If it's too strong, it can cause damage. And if it's delivered at the wrong time or to the wrong place, it may cause confusion rather than healing. That's why understanding pharmacology is not just for pharmacists and doctors, it's important for everyone who uses medicines. Now, medicines don't work by magic. They don't enter your body and randomly fix problems. Instead, they work by interacting with very specific targets inside you. These targets are usually receptors, enzymes, ion channels, or other specialized proteins that control how your body functions. A helpful way to think about this is the lock and key analogy. Your body has many locks, and each medicine is designed as a key. When the right key fits into the right lock, a chain reaction begins. That reaction might reduce pain, kill bacteria, calm inflammation, lower blood pressure, or correct a chemical imbalance in the brain. But when the key doesn't fit properly, the result may be weak effects or unwanted side effects. Once a medicine enters your body, it begins a journey. This journey is known as pharmacokinetics, which simply means what the body does to the drug. Pharmacokinetics explains how a medicine moves through your body from the moment you take it to the moment it leaves. This journey happens in four major stages, commonly remembered using the abbreviation ADME: absorption, distribution, metabolism, and excretion. Everything begins with absorption. Absorption is how a medicine gets from where you take it into your bloodstream. When you swallow a tablet, it doesn't instantly start working. First, it must dissolve. Then it must pass through the lining of your stomach or intestines and enter the blood. Some medicines are absorbed very quickly, especially liquid forms or fast-dissolving tablets. Others take longer, especially those designed to release slowly over time. Food can slow absorption, speed it up, or even block it entirely. This is why some medicines must be taken on an empty stomach, while others are better taken with meals. After absorption comes distribution. Once a drug enters the bloodstream, it doesn't stay in one place. The blood acts like a highway, carrying the medicine to different organs and tissues. But distribution is not equal everywhere. Some drugs concentrate in certain tissues more than others. Fat-soluble drugs may accumulate in fatty tissues, while water-soluble drugs stay mostly in the blood. Some medicines are bound to proteins in the blood, which affects how much of the drug is free to act. And then there's the brain, protected by the blood-brain barrier, a powerful filter that blocks many substances. Only certain medicines can cross this barrier, which is why treating brain conditions requires very specific drugs. Next is metabolism, the stage where your body chemically changes the medicine. This usually happens in the liver, which acts as the body's main chemical processing factory. Liver enzymes modify drugs to make them easier to eliminate. Sometimes metabolism reduces a drug's activity, sometimes it stops it completely, and sometimes, very interestingly, it activates the drug. These types of medicines are called prodrugs. The speed of metabolism differs greatly between individuals. Genetics, age, liver health, alcohol use, and even other medicines can make metabolism faster or slower. This is one reason why the same dose can be perfect for one person and too much or too little for another. Finally, we have excretion, the process by which the drug leaves the body. Most medicines are excreted through the kidneys and urine, but others leave through feces, sweat, saliva, breast milk, or even the air we breathe out. Proper excretion is extremely important. If a drug is not eliminated efficiently, it can build up in the body and cause toxicity. This is why kidney function is carefully considered when prescribing many medicines, especially in older adults. That entire journey, absorption, distribution, metabolism, and excretion, explains how the body handles a medicine. But once the medicine reaches its destination, another story begins. This is where pharmacodynamics comes in, which describes what the drug does to the body. Pharmacodynamics focuses on the effects of a drug and how those effects are produced. Some medicines activate receptors, turning on certain responses in the body. Others block receptors, preventing natural chemicals from producing their effects. Some inhibit enzymes, slowing down or stopping chemical reactions. Others replace substances the body lacks, like hormones or enzymes. And some medicines work in more complex ways, influencing multiple pathways at once. Understanding pharmacodynamics helps explain why medicines work, why they sometimes don't, and why side effects happen. One of the most important ideas in pharmacodynamics is the dose-response relationship. This means that the effect of a medicine depends on how much of it is taken. Too little may have no effect at all. Too much can be harmful or even dangerous. There is usually a range where the medicine works best, producing the desired effect with minimal risk. This brings us to the concept of the therapeutic window, the safe zone between an ineffective dose and a toxic dose. Medicines with a narrow therapeutic window require close monitoring because small changes in dose can lead to serious problems. Another layer of complexity is the fact that human beings are not identical machines. Age, body weight, sex, genetics, diet, pregnancy, disease states, and even lifestyle choices all influence how medicines behave in the body. This is the foundation of pharmacogenomics, the study of how genes affect drug response. Some people break down drugs very quickly, others very slowly. Some people are more sensitive to certain drugs, while others are resistant. As science advances, treatments are becoming more personalized, helping clinicians choose the right drug and the right dose for each individual. No discussion of pharmacology is complete without talking about side effects. Side effects happen because medicines rarely act on just one target. They may affect similar receptors in different parts of the body or interfere with normal processes. Some side effects are mild and temporary, while others are serious and require stopping the medication. Understanding side effects allows patients and healthcare professionals to weigh benefits against risks and make informed decisions. Drug interactions are another critical aspect. Medicines can interact with each other, with foods, and even with herbal supplements. One drug may increase the effect of another, decrease it, or change how it's metabolized. This is why it's so important to disclose all medications and supplements to healthcare providers. Even everyday foods, like grapefruit, can dramatically change drug levels in the body. Medicines also come in different categories based on what they do. Pain relievers reduce discomfort, antibiotics fight bacteria, antivirals target viruses, antifungals treat fungal infections, antihypertensives control blood pressure, psychotropic drugs affect mood and behavior, and vaccines prepare the immune system to fight disease. Each class has its own mechanisms, benefits, and risks, but all aim toward the same goal, restoring balance and preserving health. Behind every medicine is a long journey of discovery and testing. Drug development starts with identifying a biological target, designing molecules to affect it, and testing those molecules for safety and effectiveness. Clinical trials involve thousands of volunteers and strict regulations. Many potential drugs fail along the way, and only a few make it to the market. This process takes years, sometimes decades, and requires enormous resources. Modern pharmacology is also moving toward personalized medicine, where treatments are tailored to the individual rather than the average patient. This approach promises better outcomes, fewer side effects, and more efficient healthcare. We should also distinguish between over-the-counter medicines and prescription drugs. OTC medicines are generally safe when used correctly, but misuse can still cause harm. Prescription medicines require professional supervision because of their strength, complexity, or risk profile. It's also important to remember that many medicines come from nature. Plants, fungi, and microorganisms have provided humanity with powerful treatments for centuries. Modern science refines these natural compounds, improving their safety and effectiveness. Responsible medicine use is essential. Medicines should be taken exactly as directed, stored properly, and never shared. Completing prescribed courses, especially antibiotics, helps prevent resistance and protects public health. In the end, medicines are not just chemical substances, they are tools of communication between science and the human body. Pharmacology helps us understand this dialogue, allowing us to use medicines wisely, safely, and effectively. Medicine is more than a cure. It's a carefully crafted conversation with your body. And the better we understand that conversation, the better choices we can make for our health and the health of those around us. Before you leave, I want you to think about this. The next time you take a medicine, remember, it's not just a pill. It's a powerful interaction between science and your body. Millions of microscopic processes begin the moment that tablet dissolves. Receptors activate. Enzymes transform molecules. Cells respond. It's extraordinary. But here's something even more fascinating. If such a small tablet can change your heart rate, your mood, your immune system, or your blood pressure, what does that tell you about how powerful, and how delicate, your body truly is? And let me ask you something personal. Have you ever taken a medicine that worked perfectly for you? Or one that didn't work the way you expected? Why do you think that happened? Drop your experience in the comments. Let's start a real conversation about medicines and how they affect us differently. If you found this video helpful, don't forget to like, share, and subscribe to Pharm Geraldinho TV, where we break down complex medical and pharmacological concepts into simple, practical understanding. Stay curious. Stay informed, and always respect the power of medicine. See you in the next video.